This week has been Remembrance Day here in Canada, and it's wonderful to see the military men and women with their uniforms on. They look incredible, and we're so grateful for their service. But one of the things that came to my mind is a term that we use in chiropractic, which is military neck. Military neck. Now, what is military neck? Military neck isn't just a straight neck from posture. A person who has a military posture can actually have a nice curve in their neck, but a military neck is a straight neck that you see on x-ray. So you really can't tell whether a person has military neck unless an x-ray has been taken from them from the side position. Now, what is the problem with military neck? Well, if we look at our cervical spine, our neck, it is meant to have a curve in it. 35 to 42 degree of curve, which is ideal. So this would be the back of the skull. So this were my neck. It would be positioned like this with a nice C-shaped curve in it. Without that curve and that spine being straight like that, what happens is we lose the flexibility in the spine. All of these spinal bones, how they overlap each other, these joints overlap on the back like shingles. And they're meant to be able to carry the weight of the skull, which on average for an adult is 13 pounds. It's a fair bit of weight. But that curvature allows for shock absorption. The discs in here between the bones, these shock absorbers, they're able to do their work and place the weight of the skull back into the posterior joints in the neck. But when we have a military neck, when that develops, and it develops because of problems in the spine that happen very quietly from months to years, okay, to decades. And it changes the brain's perception of what true alignment should be. And so it flattens out like this, and now the weight of the skull, that force is being transitioned into the front part of the spine. And all that force is going through this axial direction into the fronts of the bones, into the discs where they're really not to be carried. So what we see over time is disc degeneration. We see osteoarthritis or degenerative arthritis in the spine. And we'll see the bones getting closer and closer together, squeezing on these nerve roots. And the biggest problem with all of this is the fact that it causes stretching in the spinal cord. This is by far the biggest problem. It isn't necessarily painful in its earlier stages, but as time goes on, that stretching in the spinal cord affects the ability of the cord to carry messages. And what research shows is that there is a one-to-one correlation with, in this particular case, is head-forward posture and loss of neck curve and decreased signaling coming through your spinal cord. These are life-giving signals that every part of your body needs to function. So, with military neck, we'll see people having neck pain. We'll see TMJ issues. We're going to see headaches at some point. And as I mentioned before, we're going to have degeneration in the spine, which can affect all the nerves coming down into your arms. And if it's affecting your cord, it's affecting your entire body. So what do we do as a chiropractor? Well, number one, we need to determine whether the person has military neck. So we take x-rays. We do our hands-on assessment to check to see how these spinal bones are moving. And then we take x-rays. All right, and if we find problems in the spine, something we call subluxation, which is joint dysfunction, the joints aren't moving properly, causing nerve interference, which is the number one reason why the curve would be missing. And what we want to do is we want to actually correct this by doing chiropractic adjustments. Those who are doing structural corrective care, such as myself, also use devices like this called a cervical dental, all kinds of peer-reviewed research behind this. It's meant to stretch tight ligaments on the front of the neck. It's like shrink wrap that holds the spine. After it's been like there in this position for months or years, it's going to be quite tight. So we have to stretch that ligament out. And then thirdly, giving prescriptive exercises that are specific to military neck and specific to the individual where the straightness is occurring in their spine. All right, so that's what we're doing, is we're finding and correcting these problems so that that spine doesn't continue to degenerate and degenerate your health. So if you're in Ottawa, we're in downtown Ottawa. If you're here, contact us. If you want to find out what your spine is doing, you've been having some issues, or you have concerns that you might have military neck, give us a call, contact us, and we'll do a free consultation. We'll do an examination, a report of findings with you so that you can know what's going on. So we want to defend against military neck, make sure that that's not a problem for you.